admitted today from the ED with complaint of severe abdominal pain times 1 day. She denies any medical history or medications. When she got to the emergency department, she was rating her pain a 9 out of 10. Her vital signs were stable. She was afebrile. The emergency department treated her pain with 2 milligrams of morphine sulfate through her right peripheral IV in the AC.
Hi, my name is Ariel. I'm going to be your nurse today. Can I have your first name and your last name and your date of birth?
Emily Frazier, 13092.
Okay. All right, Emily, I'm just here. I'm going to look at your vitals and I'm just going to do a quick assessment, okay? So I'm going to look at your wristband. Okay, everything's correct. All right. Well, thank you. So I'm just going to start with your vitals, okay? I'm going to make sure this bed is locked, so I'm just going to raise you up because I'm going to be looking at a few things. Okay. All right, well, it doesn't. Okay. All right. Check your blood pressure. Okay, okay, do we have any, we have a IV here, and this is flowing? Okay, it's flowing, okay. And there's nothing on this arm? Do you have nothing? Okay, so I'm gonna go ahead and put the blood pressure cuff. Okay.
118 over 90.
Okay, 118 over 90, so that's within normal, that's within a normal range. Okay, and then I'm gonna put the pulse ox, what is it?
99%.
99%, is she room air?
Yes.
Okay, room air. Okay, and then, so it's gonna take the pulse as well. What is her pulse?
106.
Okay, 106, okay, that's an elevated, pulse. Okay, so let me go ahead, we're gonna take your temperature, so I'm just gonna go ahead and put this underneath your tongue. All right, and when it beeps, then we'll remove it. All right.
98.9.
98.9, okay, within normal range, okay. Okay, so blood pressure, pulse, I'm gonna check respirations. Okay, so I like to do this, I like to hold on to this. I'm gonna pretend like I'm doing this and I'm gonna watch her breathe. Do you actually want me to watch her or are you gonna give me a respiratory rate?
20.
20? Okay, it's not within normal range too. Okay, so while I'm here, I'm gonna go also check pulses to feel if they're, you know, what are her radial pulse? What, okay. Alright, I'm gonna check your pupil pulses. And her shoes would be off. Are those the only, okay, I want to ask. Okay. I'm just gonna check your carotid too. Okay, and while we're doing that, I'm gonna check to see if she's warm. Is she warm? She feels warm. Okay, I'm gonna check her turgor. Okay, turgor's good. I'm gonna check her cap refill. Okay, return, it's less than 30 seconds, okay. Okay, and do we have, we don't see any edema on her legs. Okay, and then I'm gonna look at her IV site. So now I'm looking at her IV and her arm. I'm sorry, I'm gonna look at this. Okay, so it looks like it's red. This picture's kind of blurry. Does it hurt you? How's your IV site?
It's uncomfortable.
It's uncomfortable? Okay. Is it, and I'm feeling it, okay, if it's uncomfortable, it looks red, maybe it looks swollen, so maybe it's warm. Okay, we're gonna have to get this changed. I'm gonna go, what does she have running through this? She has morphine or is that, nothing, okay. Okay, so I'm gonna look for, all the things around it. Okay, so it's red, it's uncomfortable, I'm gonna have to stop that, and then we're gonna have to change that for you. Okay, is there any other pain? Are you feeling, on a scale of 0 to 10, what is your pain level currently?
9.
9, okay, what's hurting you?
My stomach.
Your stomach's hurting you? Okay. When did this start?
Yesterday.
Yesterday? Okay, I'm gonna just feel and you let me know if you feel any pain, okay? Okay. Do you feel any pain?
Yeah, it's painful.
Okay, so, alright, then I would have stopped when you said that, okay, and then I would still go from there and palpate around the area. Okay, and is it distended? Okay, anyways, I'm gonna check to see if it's distended. Okay, so you said it started yesterday. It's a 9 out of 10. Okay, is there anything else? Do you feel any other symptoms other than just the pain in your abdomen, like
Nausea.
related to nausea? It's making you nauseous, okay. Have you thrown up?
No.
No? Okay. Alright. Duration, okay. Alright, do you have any other wounds that, I'm looking at your skin, I'm looking for wounds or incisions, so it's just your abdomen and we have this. Do you have any other wounds that I should know about? No? Okay. Alright. Okay, I'm gonna check your heart sound. Okay. Just gonna move this. Sorry. Alright, so I'm gonna check your lung sound now. So I'm gonna tell you when to breathe in and breathe out, okay? So breathe in, breathe out. Okay, so I would just ask you to do the same. Okay. Okay. Can I have you sit up? Okay. I'd have you breathe in too. And then I would have her breathe in, breathe out. Alright, so I'm gonna have you lay back down and then I'm gonna listen to her bowel sounds. And let me know if you have any discomfort. I'm gonna try to be as gentle as I can. I know that it hurts and it's. Okay. Okay. Alright, do you know where you're at the moment?
Yes.
Okay. Do you know what's happened to you? Can you tell me a little bit about what's happened to you?
Just admitted for abdominal pain.
Okay, yeah. Okay, do you know what day it is today? Like the day of the week?
Yes.
Okay. Okay, and then she told me, so she's oriented. Okay, I'm gonna look at your eyes. She told me her name earlier. Alright, so I'm just gonna shine a light in your eyes. I'm just gonna look, okay? So just look straight at me, okay? Okay, and then just follow my pen, okay? Okay, so her eyes. Okay, let me see. There, she's got 3. She's got 4mm pupils. She's Perla. She's oriented. Okay. Do you feel any tingling or numbness anywhere?
No.
No? Can you wiggle your toes? Okay. Alright, now I'm gonna have you squeeze. Can you squeeze my hand? Okay. Squeeze my hand. Okay. I'm gonna have you push on my feet. Okay, perfect. Okay. Then let me see. Can you lift up your feet, your right foot? Okay, your left foot. Okay. Can you lift up your left arm? Okay, your right arm. Okay. 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 You need to push up your shoulders. There you go. Okay. Alright, so S1, S2 is intact, regular rate and rhythm. I didn't see you coughing, but do you have a cough? No cough, okay. Her work of breathing seems to be unlabored and normal. Lung sounds were clear, rate and rhythm of her lungs were normal. Yeah, her cardiac regular, you call it rhythm, regular rate and rhythm, there you go, S1, S2 intact. Okay, well, check your mucous membranes, can you open your mouth please, here?
Sorry, I'm nodding too.
Yeah, I was gonna say, it's okay, it's okay.
Oh, pennies right there.
I think that's my pen. Oh, I see what you're saying. I don't know where my pen light went, but it's,
You had it in there.
oh, it's disappeared. Okay, so I'm gonna. Alright, okay, open your mouth. I'm just gonna look inside. Okay, okay, her face, everything seems to be symmetrical. Okay, I'm gonna look at her ears. Okay. Okay, alright, you said no incisions, no wounds. Okay, checked your motor strength. Did all the vitals, checked your temp. Checked your pulses. You know what? Are you, I know you said your abdomen hurts, are you able to get up and walk? Do you think we can do that, or is it too painful for you to do that?
Too painful.
Too painful? Okay. Well, you know, you did get up to go use the restroom earlier, so, and you didn't need any did you need any assistance? Were you able to get up and go okay? Okay, so, when was the last time you pooped?
Do I answer that? Okay, I thought I was only supposed to, okay. Today.
You did? Okay. How did it look like? Was it hard? Was it difficult to do that?
It was normal.
Was it normal? Was it normal color?
Mm-hmm.
Okay. And then are you able to urinate? I watched you get up to use the restroom. Were you able to urinate okay? Was there any pain?
No pain.
Okay. And then the color, how was the color? Was it
Yellow.
yellow? Okay. Was it cloudy? No, not cloudy. And like you said, it didn't hurt to urinate. Okay. Okay. So if she had any drains, there's no tubes, chest tubes or anything? Okay. Everything's symmetrical. Okay, do you have any loved ones that come in to visit you?
No.
No? Do you live alone or do you live with anybody?
Alone.
Live alone? Okay. Do you have a dog at home?
Yes.
What do you look forward? Do you look forward to going back to your dog?
Yes.
Do? Okay. Okay. Am I timed? Or just stop whenever? Oh, okay. So I check temperature. Okay. Okay. All right. Well, is there anything that I can do for you before I leave?
I'm good.
No? Okay. Okay. Well, I'm gonna go ahead and we're gonna fix this IV. I'm gonna call IV therapy. We're gonna get you a new one. I'm also gonna call the provider if this is a maintenance fluid to see, you know, what we can do for you if you still need that, and then to fix this for you so you don't have as much pain. And then your abdomen too. So I'm gonna call the provider, let them know it's a 9 out of 10, and see if you have any medications that we can help you with that pain at the moment. But you were able to poop yesterday, so that's a good thing. I'm hearing normal bowel sounds, but I'll go ahead and we'll get that looked at, okay? I'll call the provider. So let me go ahead, I'm gonna lower you back down, I'm gonna give you your call light, make sure bed rails up, okay? Alright, so I'm gonna take out my equipment, throw it away, wash my hands, and then I'm gonna document my assessment. And that's it.